Alright, now for the next up, we'll get to discuss what is known as a TFCC tear. So TFCC tear, So the TFCC, you guys might actually want to know the full meaning of TFCC. It just simply means Triangular Fibrocartilage Complex. Alright, of course, it's found here, right, in between this. Okay, let's just talk about it. So is actually damage to the triangular fibrocartilage complex. This is a key structure on the ulnar side of the wrist. That's like it stabilizes the pinky finger on this side. So it stabilizes and allows smooth rotation and grip. Now, if there's an inflammation or tear in this ligament, okay, or cartilage or fibrous stuff, anyhow you can put it, it causes a lot of wrist pain. Now, I came across this when I was reading about common causes of wrist pain. So what is a TFCC tear? TFCC, just so you know, is a complex. When you say something is a complex, there are a whole lot of things there. It's not one thing. So there's ligaments there, there's tendons there, there's cartilage there, and all of them, they are just trying to support the ulna, okay, and the radius bone. This bone and this bone, this complex here is trying to tie them together so that it will stabilize your wrist. Okay, so it cushions and also stabilizes the wrist during rotation and gripping, support load bearing activities involving the hand. Do you understand? So what could actually make this complex to kind of tear off? So sometimes it's traumas. You fall on outstretched hand, sudden twistings or motions, or sport injuries like gymnastics, tennis, Sometimes it's degenerative, so wear and tear over time, often seen in adults or those with conditions like rheumatoid arthritis. So symptoms: there's pain on the ulnar side of the wrist, there's clicking or pooping sounds during movements, swellings or tenderness, reduced grip strength, difficulties rotating the wrist or bearing weight. Okay, so diagnosis is seeing that the patient is actually having a lot of pain in their wrist. Then sometimes I just want to do imaging just to further confirm. Okay, so you can see it. So treatment: rest, splintings, use non-steroidal anti-inflammatory drugs to tackle the inflammation, corticosteroid injections, bracings, arthroscopic surgeries or open repairs, and all of that. Okay, so that's just what the TFCC tear simply means.